Hi, my name is Dr. Ruben Garcia. I'm the clinic director here at Peak Physical Medicine. I was just making this video in response to the NeuroToxic Questionnaire that you completed. I just wanted to go over the results and what you would find. You should be getting the score to your test in the email as well. But I wanted to go over how we kind of go through that test. There are 4 sections that you completed. Each section has a specific form of toxicity that we're trying to identify. So section 1 is looking for heavy metals. Section 2 is general toxicity. Section 3 is mold or lime. Section 4 is general toxicity. So depending on how you scored in each of those sections, it can indicate an overburden in one of those areas. Now, if you scored over 100, you have severe toxicity. Anywhere from 50 to 100, it's moderate toxicity, and anything less than 50 is less toxicity. What the research is showing is that inflammation, more specifically cellular inflammation, is the root cause of many chronic conditions, including cancer, fatigue, resistance to weight loss, any of these types of conditions, autoimmune disease, really stemming or starting from cellular inflammation. So if we can identify that and start to correct that underlying problem, we can start to see a lot of symptoms actually starting to clear up. So with that being said, what we do offer here in our office, once we do take this toxicity test and identify where we stand, we can do what's called a meta-oxy test, and I'll include a link to also show a little bit more detail what that is. It's a urine test that does measure the amount of inflammation or oxidative stress on the cell wall, so we can identify how much inflammation you're dealing with. The other test that we do is a visual contrast test, visual contrast sensitivity test, to identify the lack of being able to identify contrast in images, and that shows inflammation around that cell wall, because what it does is it decreases the amount of blood flow into your eye, and so it's a good way to measure levels of inflammation as well. The meta-oxy test is 50 times more accurate than a blood test, so that's why we like to do it here in our office. So you'll get a little bit more information about that on our email. But if you're interested in looking into why you're dealing with this amount of toxicity, we would gladly invite you to come in, give us a call, and we can go ahead and move forward with those tests. If you're in the severe toxicity range, we highly recommend that you look into moving forward so that we can help resolve some of your symptoms. If you're in the moderate toxicity range, obviously you're moving in a direction that you're not happy with. You're starting to experience some symptoms, and it's definitely a good idea to start looking into why that's happening. If you're in the less toxicity range, obviously there's a reason why you completed the questionnaire. Maybe you're starting to develop some symptoms. You're not quite sure why they're there. Maybe other doctors you've been to not really finding answers. So it's a good time to even just test and see what's going on there, and we can get you started and even move you back into feeling better so that you don't move into these other categories. So again, if you have any questions, feel free just to respond or reply to the email that you're going to receive. We will gladly answer all your questions and help you move in the right direction. All right, thanks.